Welcome to the Protecting Your Nest podcast. The prevalence of obesity continues to grow throughout the world. My guest and I are residents of the state of Illinois in the United States with an obesity prevalence in the 30 to 34% range, while many of the southern states in the United States are in the 35 to 39% range based on the CDC's obesity prevalence maps. Now, when averaged out overall, the Midwest and South in the U.S. have very similar obesity prevalence rates, with the highest rates being in my wife's home state of Mississippi. And my old college roommate, Darren Flowers, he is from Alabama, and it's another state with a high prevalence rates, both around 39%. So shout out to my wife and to my old college roommate. But today, I wanted to have a guest who can not only share how keto and intermittent fasting has really helped him achieve his weight loss goals, but also share some perspectives from the lens of the LGBTQ community. Rather, it's how the LGBTQ community reacts to the obesity question or even the recent controversy over Dave Chappelle. Today's guest is Anthony Palermo. Anthony is a registered medical assistant who attended Northwestern and is now working on his BA in healthcare administration at Western Governor University. We've worked in the same clinic for many years, and although he will be transitioning to another role, I have personally seen his transformation using keto and intermittent fasting, and just really wanted to share his story with you. So, Anthony, I appreciate you, and I welcome you to the Protecting Your Nest podcast.
Hi, Dr. Hampton. Thank you.
Well, I appreciate you. I know we're both in the middle of our busy clinic day, and just wanted to bring you to the podcast. And sometimes the best stories are the ones that are right next to you. And I do remember overhearing you mention keto, and I don't think I've really fully appreciated your transformation because you worked on the other side of the clinic.
Yeah.
But clearly, people on the other side of the clinic saw this, and I just thought, why not bring a healthcare professional to the podcast who can share his story? So, talk a little bit about what your transformation was, how much did you lose, and how did you achieve it?
Yeah. So it was a long transformation. It probably altogether took about a year and a half to do altogether. And when COVID happened, it actually backtracked a lot of my transformation, because then I started gaining that weight, a little bit of that weight back, because of not being able to go to the gym, not being able to and then always eating whatever we had in the house, and the shortage of supplies and everything. So it was having to start all over again. So so in the beginning of my journey, I was probably, I want to say probably about 250, 260, 260 pounds. I stand at 5'4", and for a 5'4" type of guy, such as myself, a shorty, such as myself, it shows. It's prevalent, man. It's it's bad. I mean, I remember sweating, tying my shoes in the morning, or getting out of the shower and having to actually sit down on a toilet to take my breath because I was obese. So what happened was that I wasn't feeling good, and I was getting chest pain, and and at that time I was 37. I'm 42 now. I was 37 and about 37, 38. And I went to my primary care doctor at the time, and she did a full workup. All my levels came back. Cholesterol was in the 300s, dangerously high. My blood pressure was like almost like 190 over like 110. It was 110. It was everything was out of whack. So my doctor wanted to send me over to our local hospital over here, not too far from where I lived at the time, and said, you're on the road to having a massive heart attack. My EKG came back, waves were a mess. Well, all I was doing was eating fast food. All I was doing was eating at restaurants. I was married at the time. When I was bigger, we would always eat out. My ex partner at the time wanted to eat out all the time, and I love to eat. So anyway, I didn't want to go, and my doctor said, well, I'm going to have to put you on a ton of medication. I was on a high dose of a statin, a cholesterol medication. I was on a high dose of high blood pressure medication, and she introduced keto to my life, and I remember thinking, what is this? Like, I heard about it, and I'm like, and then she told me, like, it's this intermittent fasting, and green is good, so anything green is good. And I remember starting it, and I was angry, man. That first month and a half, man, getting adjusted to it. I actually just started here at at our place, in our clinic, and it was bad, but I must tell you, it saved my life. Like, I that saved my life. So yeah.
Well, it's really interesting to imagine. First of all, just to imagine you at 250 or 260, I can't remember any of that. And to hear at 37, you're at risk for a heart attack is insane.
Yeah.
What's even more amazing and exciting is that you had a clinician who suggested keto in a world where a lot of clinicians think, keto is going to kill you. So, and it's actually quite the opposite. It actually can save your life. So, and the last thing I want to say is that you mentioned you didn't feel so good in the beginning, and for those who are listening, it's not unusual to go from fast food and processed food and starch and sugar to this type of eating pattern and feel horrible because your body's not even sure what to do. It's like it's used to the addictive food. So I even made a video for those who don't know. I have a YouTube channel, and on the YouTube channel, there's how to prevent carbohydrate withdrawal video. So I think that's a good video to touch on because you will lose salt and magnesium and potassium, and you feel horrible. So thanks for mentioning that, because a lot of people don't do keto because they're not going to feel good sometimes. Now, thankfully, a lot of people feel fine, but some people don't. So thanks for that. I look at you now. I see you're in your 40s now, just crossed over. You're getting old like your buddy here. And I wonder, though, when you were younger, what was it like? Did you have issues with obesity as a kid? What was going on at those younger years?
So I come from an Italian. I'm Italian American, 100% Italian background, and I was introduced to carbs at, like, the moment I could eat. The moment I had teeth, I could eat. I was introduced to carbs, right? Pastas and breads, and everything is dough and just the starches and everything. So I wasn't. My mom, on the other hand, my mother was very, very good at keeping my diet, keeping me underweight. And of course, when I was a kid, I played a lot. I mean, we didn't. It was, our life was not set attention. We were not so much in the house like we are today. I mean, I'm dating myself, but I remember when Atari was the big video game. So, and Nintendo. So I was never interested. I like to be outdoors. So my mom made sure that once I ate, I went out and played. So I wasn't as a kid. However, when I did get, before, once I hit puberty, I got that, like, puberty, that puberty weight gain. And I developed high blood pressure, adolescent high blood pressure at an early age. And again, I was at a doctor's office saying, what is going on here? And I also come from a family of bad hearts. So I was actually had to be put on a diet at a very young age, and actually, my mother having to watch my weight and going for blood pressure checks at, like, 10. So, but once I got older, I got into sports. So I played ball, and I did a lot of sports and things, and wrestled and stuff. So my weight was always, when I got in high school, I was, I didn't have to worry about it. But then after high school happened, so that's
That's
another story.
fair.
It's
All
another
right.
experience.
There's a gentleman in the low carb community in South Africa. His name is Professor Tim Noakes, and he got in trouble, and certainly won his case because I think he tweeted that it was okay for our babies to eat, this type of diet, right? And and the question is, what's wrong with some animals and some non-starchy vegetables? I'm not sure how that can harm our babies, but I bring it up to say that our babies can get sick too. Some people will start these dietary patterns, and they'll only focus on themselves, and they'll still bring garbage home to their babies, right?
Yeah.
So don't do that if you're listening or watching. on the YouTube channel, make sure that you feed your babies animals and non-starchy sides too. There's nothing wrong with that. There's no reason why, as you suggest, to eat a processed food like pasta, which is flour, water, and egg. That's not food. That's garbage. So, and again, we will indulge. We want to hold on to our heritage, so we will indulge sometimes, maybe. But
Oh
the
yeah.
point of it is, it's not necessary to feed our babies garbage, thinking it's okay for them when it's not okay for us. So very, very interesting. So now you've made this transformation. You probably don't look anything like you did previously, and you probably have people approach you and look at you differently. So what types of compliments do you get as it relates to your transformation?
Well, I'm not good at compliments. I never have been. So whenever someone gives me a compliment, I kind of just, put my head down and go, "Oh, shucks, thanks." And I actually want to kind of point out, as being a member of the LGBTQ community, we there's a standard in our community that's set pretty high. If you don't look the part, you don't really get the noticing, going to parties and to the bars and all of that stuff. It's a very, can be shallow sometimes. And I remember when I was overweight, I mean, getting a date was was a joke because, before I got married, of course, I snagged one. But before I got married, I remember I remember like being on all the apps and just like and actually being shamed, believe it or not, saying, "Well, you're too fat to be on here," and God, you're ugly, and what is wrong with you, and why are you so fat? Oh yeah, I got shamed a lot, being on the apps, and it's been known, it's been bullying, it's been known to happen. So now I did this transformation, and at work, and I go to the gym 4 or 5 times a week. I'm literally at the gym 1 to 2 hours a day. I joined CrossFit, as well. That's a big thing. And I'm really keeping an eye on my weight and my health. But now I'm getting all these these little notices, and
Right.
I just don't know how to handle. So I blush, and I just put my head down and go, "Oh, thanks." It's a blessing to me to be able to do this. I'm not a vain person. I mean, don't get me wrong. I like to look good and dress
Right.
well, but I'm not a vain person. And I've always looked at somebody on the inside as well. And I think that's one of the biggest issues with our community, with the LGBTQ community, is it's all, a lot of it, a majority of it is about the look. And that's something, if I could change, I would, because somebody out there who is overweight, who is their self-esteem, like mine, was very, very bad, can, it could be detrimental. So, but no, my transformation, it's been, it's been good.
It's been good. Right. Right. Yeah, well, you do walk around with confidence. I would have not considered you introverted or anything like that, but I understand it because although I feel comfortable getting in front of this camera or in front of a mic, I am a little bit of an introvert too, and I'm more comfortable being by myself with a book in my hand. Interesting enough, but that I never would have thought about the fact that the standard was higher because you're part of the LGBTQ community. I mean, it would have never occurred to me, and that's very interesting. But it makes sense because it does appear that a lot of people in the community, it seems like they really focus on taking care of themselves, how they appear, how they dress, and it makes sense in retrospect. But I never even thought about it. And that's why I think these conversations are important, because it's important that we see the world through somebody else's lens. And so that's very insightful, and I really appreciate you
And
sharing that. I
also, to add,
Yeah.
I'm sorry, doctor, just to add too, a lot of the suicide rate is higher as well, because of what you hear and the way you feel. There was a point too where I contemplated it, because of being, harassed. Not harassed. I'm sorry, not wrong word, but being bullied. Like, just being able to walk down the street and getting those side eyes, and yeah, it's, I could do my own thing about that. But yeah.
you know, we're already dealing with stigmatism when we're struggling with weight. You may even be dealing with stigmatism when you're dealing with just being in the LGBTQ community.
Oh yeah.
And the irony of all of this is that you would think that that community would certainly be there to support you,
Yeah.
because they should understand what that stigmatism is. So that's very interesting. That it's kind of like not the support you would have expected. Now, let me ask you this: is that like was that universally true, or was it some pockets of people in the community that were able to give you the support, or did you have to find that support elsewhere?
No, I had some good friends. I mean, I had one of my best friends who is part of the LGBTQ community. Was my biggest supporter, and he shout out to Brian, by the way, who was my he was my big supporter. Like, let's go to the gym and love yourself and be proud of who you are, and you'll lose weight and we'll work on it together. And I had but one, however, when you're part of a group, or when you were part of a group and you were big, you're shunned. So I had one or two maybe good friends that supported me. And then when I lost this weight, like, all of the other friends that I had came out of the woodwork. Oh my God, you look so great. And I thanks. Where were
Right,
you when I
right.
needed you? I remember, one incident when I think I don't know if I went on a date or I came home from the bars, and I just sat down and I cried. I just cried my heart out, and just put my head in my hands and said, I at that, as you get older, losing this weight is not easy as you were in your 20s. So I remember, like, not being able to lose, like, this weight was just there, and just crying. Like,
Yeah,
I never wanted a Big Mac so bad. I mean, because that was my comfort. Like, that was my comfort. So yeah, but I did have one. I had one really good friend, and but that's all I needed, and that he was a lot of my backbone to get this going. So yeah.
that's cool. And I'm going to ask you a few more questions about keto and maybe
Yeah.
even fasting. But before I even go there, I think I'm going to stay on some of the talking points we're just laying out right now. And I guess another question that's related is, from a male to female perspective. So I know, I've seen studies actually, because I'm in school, I'm always reading stuff. And I think it was during my obesity days, but it talked about how lesbian and bisexual women are more likely to be overweight or obese compared to heterosexual women, and gay men are less likely to be overweight or obese compared to heterosexual men. I thought that was interesting. Do those study results surprise you in any way?
You know, I I literally, I don't really get, I personally don't get into studies. I read what I need to read, being being part of science, but I think it's just the individual.
Mhm.
I have lesbian friends, and some of my lesbian friends are, bigger.
Mhm.
Some of, my own niece. I have my niece, my step niece is part of the LGBTQ community. Excuse me, and she's a bigger girl, but she works out, and she got bigger arms than I do. She's freaking massive. She's a hater. I think it's who you are. It's what what you want to do. I mean, a lot of people, view their body as, hey, I'm liking it. This is who I am. I'm proud of who I am, big or
Yeah.
small, and that's great. Uh, you know, um, I've never really seen, or actually even asked anybody about that. But from what I've seen, no, I said, it doesn't surprise me.
Yep.
I think women by nature, back in the 50s and the 60s, had to have that perfect waist, right?
Right.
That perfect
Right.
physique, and with the transformation, and with the liberation of women, and the liberation of the women's lib in the 60s and the 70s, and then LGBTQ women, hey, I don't have to be this perfect physique anymore. I can be a big woman and be okay. I don't
Right.
need you to tell me what I need to look like. I don't need society to tell me what I need to look like. I think it's great. I think it's awesome.
Yeah,
I love it. But as far as the studies, I
yeah,
should, but I really don't pay attention to the
right.
studies. I
That's
just pay
fair.
attention to the individual. And most of my friends that are lesbian are like, I'm gonna have tacos. I'm gonna have nachos. I don't care.
Right,
And I'll be
right,
like,
right.
that's cool.
Yeah,
Now, from a guy's point of view and a gay man's point of view, you know, I see more single,
right,
skinny,
right,
gayer
right.
men than bigger, um, because I think it's stigmatism. I think it's the
Yeah,
stigma.
that's right.
That the gay guy is supposed to be this. From the '70s and the '80s. If you look at the old vintage videos of guys that are muscular, six pack and stuff like that, and
Right,
that never
right,
changed throughout the course of
right.
history. So,
Okay, so and that's fair, and that really it kind of aligns with what the studies were saying, but I hear you have a perspective based on
well,
your
it's a
life
reversal, I think, too, a
experience.
little bit, because you have women that are aware of their sexuality, and they were so sequestered for so long, and so they had to be the perfect person, and even um, lesbians that were in the closet back in the '60s who could not express themselves and be who they are, you had to have that perfect physique, and now I'm out and proud.
Right,
So
right,
yeah.
right. Okay. So let's touch on a couple of more things. One is stigmatism again, but I'm thinking about health inequities and how there's poor access to mental health support, maybe even just an office visit, because a person may not feel welcome, and that person could be because of their size, and it could be because of their sexual identity. So when you think about and I know our health system, which is Advocate Rural Healthcare in Illinois and Wisconsin, in the U.S., we actually win awards for some of the types of things we're trying to do. I used to actually be part of our diversity and inclusion committee, uh, and and so I know that our organization and others are trying to address this. But when you think about healthcare as a whole, beyond our health system, how good of a job do you think we do to welcome people who are obese or people who are from the LGBTQ community?
Um. Oh, as far as our system is concerned, our system is great.
Yeah,
I mean, they're in the Pride Parade every year, and
right,
I'm personally
right.
proud of being part of
You've been
that.
trying to
That
get me to go. I have to. I promise I'm going to the next one that you.
we're gonna get a float. We're gonna
Yeah,
be on the float, Dr. Hampton. I mean, I think I'll be dressed a little bit differently,
that's
but
okay.
we'll still be on
That,
the float.
yeah, that'll
Um,
work.
but no, I think it's very refreshing to see a lot of the hospitals and a lot of the corporations that are coming together, the organizations that are coming together, and with you know inclusion, making people feel more comfortable. However, you can have all the inclusion and all of the diversity that you want. It's still about the person, the individual.
Hmm. Hmm.
I mean, I've known of doctors that are, of different cultures and different, ethnic backgrounds that, still view homosexuality as being this horrible sin, and
Hmm.
you're going to go to hell. And I've seen providers be different to, homosexuals, that part of the LGBTQ community, because of being LGBTQ, because of their cultural background. I've had to work with doctors that have had, not here, but in the past, that have had that feeling, and being completely stigmatized, and like, not even, you wouldn't even talk to me if I didn't have to put a patient or deal with assist a patient. Um, it's sad. It's sad because in the 21st century, with everything how far we've come, all of us, African American, LGBTQ. I mean, you still have those individuals that will still have that 1940s, 50s, 60s mentality of you stay over there. Um, but lately, it's like with Advocate and Northwestern, I know is one of them. I think UIC is one of them. They're great. They're great. I mean, we're making great strides.
Yeah,
Yeah.
and I think that's the world we want to live in, and it's going to take time.
Yeah.
What's scary is you have parents who may be teaching their babies the wrong messages. So
Yeah.
I think it's going to be a lifetime fight, even when we
Yeah.
leave this planet. But I think if we can kind of overcome that by getting more people aware, I think we'll be okay. the other thing I wanted to bring to the conversation, which I kind of previewed in my intro, was Dave Chappelle. That's been in the news lately, and he did make some controversial comments that was not favorable to the LGBTQ community, and I actually wanted to comment on one of the comments. And it speaks to what you just said about you think communities of color and the LGBTQ community have the commonality of knowing what it feels like to be taught to a certain way
Right.
or yeah. But anyway, he said we blacks. He says we look at the gay community and we go, look how well that movement is going. Look how well you are doing, and we've been trapped in this predicament for hundreds of years. How are we making that kind of progress? I can't help but to feel like if slaves had baby oil and booty shorts, we might have been free 100 years sooner. And so you hear comments like that, and he is a comedian. What have you been hearing in your community about how are people perceiving his comments? What's your thoughts on that?
Uh, well, um, well,
It's a loaded question, I know.
you know, well, a couple of topics. First of all, the African American community, you can't even come in a comparison with what the African American community has been through and has continued to still be through, to go through. Slavery and segregation, and still to this day, segregation and the terrible things that are going on. So that's a whole nother separate
Yeah,
entity that can't even be touched on. I can't even imagine what that would be like. Even though great strides are being made, and a lot of my friends are African American, and the community of where I work is African American, and I love all of everyone. I love everybody. I love all my African American brothers and sisters. But that's a whole other different entity. So to even touch on that would be that's another story. Um, I think what personally, I think it's sad that you're still in that mindset that you think that we're all about just booty shorts and olive oil or oil up bodies. I mean, don't get me wrong, you know, it's not so far fetched, but that's all you think of the gay community, and then you share that with the African American community, which has been through so much already.
right,
I think it's pigheaded. I think it's complete stupidity. You know, you really can't touch on something that you don't know about. I can't speak on behalf of the African American community because I'm not African American. I can only, share in the fight to bring in more, diversity and more, acceptance and more, you know, love and peace. Just like an African American who is not LGBTQ can go with what I feel and what
right,
my
right,
our what we struggled with. Um, Dave Chappelle is not obviously not gay, so I don't think he would even begin to fathom what it would be like to go through what we went through. However, you are African American, and I believe that as an African American, from what I've seen, you need to be a little bit more conscious of how you're speaking about the slavery and how what's going on and the segregation that's still going on today. Um, I believe in free speech. I believe in being, hey, it's a joke. Get it, take a joke.
right.
I was actually on Facebook last night, and I was watching. Someone put Dave Chappelle the segment on, and they were putting,
Hmm.
you read the comments, and I try not to read those comments because it kind of gets on my, it
Right.
makes me angry because then I'll start commenting. And being from the South Side of Chicago, that won't set right. So I read, and somebody said, well, oh my God, it's just a joke, and I love how everyone calls us, we're snowflakes. Everyone's a snowflake now. Oh, we're snowflakes. You're snowflakes. You guys don't, you don't understand. You don't know how to take a joke. Well, are you gay? Are you African American? How
Right.
can you say, "Oh, take a joke"? Well, no, of course we're not going to take a joke because you're stabbing. You're like literally going for our jugular. You're literally
Right.
going for us in our necks. You don't know, so of course we're not going to take a joke like that. Well, or an African American or
That's
African
right.
American. That's not funny. Like learn your audience, know your audience.
That's right.
I don't like Dave Chappelle. I mean, I'm just gonna put it out there. I'm not a
That's
fan of
right.
Dave Chappelle. I haven't been for a long time.
Yes.
I think you need to. I did like him back in the day, but I think you need to research a little bit more before you make those kind of jokes.
Yeah, that helps a lot. And again, we can't be afraid to talk about these topics. And I guess I'll share some of my thoughts too. And I think so. I do struggle because, like you, I believe in free speech, and I want to see it through the lens of a comedian. So that part. But I'll be honest, when I first heard the comments, it kind of seemed a little, because the thing about Dave Chappelle, when he talks, it doesn't even sound like a joke. He's like having a conversation. So it sounds like he's serious. Like, is
Hmm.
it a joke? Are you? So I think
Right.
his type of delivery makes it tougher because he'll talk for a few minutes and you don't even hear a joke. So it
Right.
does sound like he's making social commentary, but I do have a part of me that really wants to allow comedians to be comedians. So that's one part of it. But this is the thing, like, um, you do want to hear the voice of people, and if I make statements that um, are offensive, I need to at least hear that and have a conversation about it. Like, let's sit down and talk about it. And that's separating the whole comedy piece. It's just the fact that we've been talking about it on the podcast. To me, there's benefit in that because now I can hear the world through a different lens, which is very helpful to me. So anytime statements offends, rather it's the whole Indian thing. I went to Lane Tech High School, which is we have an Indian mascot, right? So
Hmm.
so if somebody's offended by that, we can't ignore that they're offended, and we can't determine what offended means to that group. So
Hmm.
I think that that's the thing that makes it a little difficult. And I know Netflix decided to kind of stand with him, but I just think it's important that we have the conversations, and rather the conversations lead to actual change or it just leads to awareness. I think that we've still benefited. What I'd like to see is a lot of effort put into making things safer. Like it's greater than 20 states I've read recently have laws that don't protect transgender people, right?
Hmm.
So we need to fight for those types of changes and start to protect people. And I think beyond the conversation, those are the things that'll lead to actionable changes. So, but I really appreciate you really sharing some talking points on a topic that I don't normally talk about, because I think that it's very interesting. And for those who are listening who are not part of the LGBTQ community, how we deal with obesity and how we manage is a little nuanced. And it may be that if you have somebody in your family who you know is gay, or you discover they're gay, they may struggle. And some of the struggle is because literally the struggle itself can lead to obesity. It's like a trauma, right?
Hmm.
You're being traumatized because the world's not treating you right because of your identity, and then they may also treat you differently because now you're bigger. And what we want to do is put our arms around people and support them. But the best way to help them is to understand what their struggles are. So let's kind of flip a little bit back to diet and talk a little bit about the temptation of food. As you know, even as we celebrate people coming and going, or birthdays, or whatever, we do our best. They try real hard to have some of the things that we are happier with, but at the end of the day, the other stuff tends to win the war. So what do you do? How do you figure? Is it still tempting for you to deal with those temptations, rather it's at work or outside of work? Just
My
food.
mother, my mother's a baker,
Oh
so
Lord.
she's a great cook, and my mom, anything she makes, yeah, it's hard. It is so hard. I
Yeah.
actually try not to be, because my mom lives with me. I try not to be home a lot, so
Oh,
I'm not home to eat.
is your mom
Not that I'm.
local? Is she local?
Yes, yeah, she's
Okay,
local. My mom
gotcha.
actually lives with me.
Oh,
But um, she still bakes. I mean, those, like, she just made biscottis. She makes homemade biscotti like you would never believe, and she dips it in the chocolate. And
oh Lord.
man, on a Sunday, first of all, you gotta have a cheat day, right? So especially if you've lost a lot of this weight, you're gonna slip. I
Right,
don't
right.
care. Like, you're gonna slip. I slipped a couple times when I was on keto. It's going to happen. You got to limit yourself though. So like my, I'm going through a little issue right now where my cheat day is becoming 2 cheat days on the weekend, and it's like, no, you can't do that. You got to pick one day, try and stick with one day. Go all out and have a great time.
Yeah.
But like that's that last time, the gym on Friday, and you're done, and you go home, and you're like, oh, I'm gonna have a big old pizza. Yeah, you can only do that once a day.
Right.
It's hard, especially here where we work here. I we are always having parties here,
Always.
and we have a lot of great cooks, and African American women love to feed.
That's right. That's showing
I
love.
love.
That's
I
how we show
mean,
love.
we
Yeah.
anything they make, man. It's eat peach cobbler and whatever they can make. I mean, the collard greens are good for you, but like the cornbread, I love cornbread. So, and they're always feeding you. So
Yeah.
African American women are always feeding. It's hard. It's hard. You just got to have that. You got to have that mindset. Like no, because I almost feel guilty after I'm getting to the point of I should go to the gym right now
Oh,
and burn
wow.
this off. It's almost you get so used to doing it, and you look at yourself the way you used to look. Like I still
Mhm.
have pictures in my phone of where I used to look, and I'll look at myself and go, "Oh yeah, no, yeah, I'm gonna put this down."
Yeah.
It's hard. And now the holidays are coming, so you
I
know,
know. A
I mean,
lot of
like,
them.
yeah. So it's hard. The temptation is hard. You gotta be tough. You gotta be tough.
Yeah, and I do appreciate your saying, okay, it's okay to cheat sometimes. And I think it is okay for most people. Like when you become metabolically healthy and you're kind of where you need to be, um, a lot of people can cheat. I think it's all about your goals. The first goal is to get to what you're trying to achieve in the first place. But once you get there, if you can cycle out of ketosis and have a cheat day, and you're not treating epilepsy and some neurological condition where you have to stay in ketosis, that's probably okay. If you do that and you don't have a processed food addiction and you're not triggering yourself to then some people can't cycle back onto keto because they just can't do it. I mean,
Yeah,
moms just they just like they just keep eating it. So I think people have to look at themselves as individuals and know yourself. And I certainly can cheat without it being a problem, but I have patients who can't. So I think you have
yeah.
to, yeah, you know what I mean? So I
You
think
got to be
that's where,
careful,
yeah,
especially if you have, it's like I worked actually with an old doctor friend of mine, actually when I first started in my career, and he was a very big man, and he was also part of the LGBTQ community, and before he came out, and he came out later in life, he got on the back then it was like the no carb Atkins diet, right?
right,
And I remember, I think one of our assistants we had lunch and brought back some dish, and it had carbs in it, and he freaked out, like
wow,
almost to the point of like going to the bathroom to stick his finger down his throat to throw up. I mean, that's how bad it was because he has that type of. He's like, you don't understand. If I taste a
right.
carb, I will go back to the way it was, and he lost a ton of weight, and he was so like, no, absolutely not. So you have some people that that have that the way of being, like they have that taste. I can get that way too. Like I can't stop at just one brownie.
Right.
You know what I mean? And it's hard, like that Monday, when that Monday morning comes around and you're like, oh, and then you feel different in the morning, feel like waking
Right.
up, and you're like, oh,
That's right.
so it's
And
tough.
and I think about even when I make like the diet doctor has a low carb chocolate cake, and I that's my brownie, and it has butter and dark chocolate, eggs, and vanilla flavor. Those are the only ingredients. But even though that's more low carb friendly, it's probably like 7 or 8 carbs. I think about it like
Yeah.
I don't think about steak, right? Even though I love steak, but I
Hmm.
don't. I'm not at work during my lunch break. Oh my God, I can't wait to get home. But when I think about those things that remind me of those types of foods,
Hmm.
it's like an addiction. So
Yeah.
so again, but I'm able to kind of like when I make that, I'm able to just take one, right? And I
Hmm.
know how to do that. But I think a lot of people would struggle. You also, I know because we work together, you intermittently fast. How much has that helped, and how difficult was that for you?
Well, one thing you got to learn about fasting, what a lot of people don't understand is that you still have to keep your stomach full. You still, you have sensors in your brain that need to tell it to stop wanting to eat. So if you fill up with other foods. So my intermittent fasting. So for example, like in the morning, I'll have a protein bar.
Hmm.
I need to have something. I don't like. I never was a breakfast person. And I love my coffee, but my coffee is carb conscious. So like I'll have my cup of coffee, I'll have like almond milk, or I'll
Hmm.
get like low fat or whatever, and then I'll have like Splenda, right? My bar, I'll take carbs in, but I'll take a carb like a protein bar that has like 160 carbs, 200 carbs, not 200 carbs, but 200 calories,
Calories, right?
and there you go. That's
Right.
your breakfast. And then I'll make sure that my lunch is massive. I'll make sure that I have a huge piece of chicken, a couple pieces of chicken, spinach, kale, some sort of greens, some sort of, maybe like even an appetizer if I can. Have a big lunch, make sure it's healthy, make sure it's, with low in calories, whatever. One big lunch that I know is going to fill me up, and then I'll drink water in between, and then I'll have something small in the eat. Like before, I like to eat before 6 o'clock because I feel like at 6 o'clock your body starts to wind down.
Yeah.
So I'll have like maybe peanut butter, some peanut butter, or I'll have something protein, okay, that I know is going to fill me up, that will last. I mean, it works for me. That's how kind of like what I like to do. That works for me. Some people like to have that they need to have more. Some people, eat more during the day, small meals. I can't do that because for me, I gain weight so easily.
Hmm.
You know, it amazes me how my body reacts to food. I mean, like
It
I'll have.
doesn't surprise me though, because even Dr. Tro, he's a low carb guy that's on Twitter and part of the Society of Metabolic Health Practitioners, and he struggled with weight. He's a doc, and he said the same thing. I can eat differently than him because when you've had that obesity pass, it's never really gone completely, right?
It isn't. It isn't. I
Yeah,
mean, it's what did I do? I had like yesterday morning. I had I those two kind bars with the
yeah,
nut bars. I love
yeah.
those. So I went to Starbucks, and which are terribly expensive, and I had two, and I felt like big, even though they were healthy bars. I felt like, ooh, like I felt big because my body's not used to eating breakfast. So, if I have like that one bar, that one protein bar, and if I stray away from that protein bar and get something else, my body is going to be like, no, this is not what we're used to. It's fun. It's amazing how your body is used to a certain way of doing things once it gets
That's
used
right.
to it.
That's right. Yeah,
And then that's why on Monday mornings, like when I have my cheat days, usually on Sundays, because family dinner Sundays is a big thing everywhere. It's pasta Sunday, so it's pasta and whatever, and that's why Sunday mornings I wake up and I feel like not I don't feel good because it's like
yeah,
you
yeah.
know
You kind of get out of your rhythm. So I think for those who are listening, when I think about bars and things like that, I consider that dirty keto. So if you have a bar, first of all, always look at labels, know what the carbs are. But there are some people who will see a carb number, even with the breads, it'll say 14 carbs, 13 fiber. So in theory, is one net carb. Some people will absorb some of the fiber though. So I think dirty keto is something you have to be careful of. If you can tolerate those things and it doesn't bother you, rather it's a bar of bread, that's fine. But be careful because the other piece is, will that bread tempt you to want bread, right? So you have to, again, going back to the addictive piece. So it looks like you do keto for sure. You kind of do a little bit of an intermittent fasting. It may be a dirty version when you try it, because it sounds like you may consume some things sometimes. So there's levels to this. Obviously, I'm a black coffee guy, so when I'm not eating in the morning, it's really not eating. But I know you do other things. We talked earlier about cross training. So what else have you done to maintain your weight loss? What other things do you do?
well, I think a lot of people, cardio has kind of got a good and a bad name. I try and do a lot of cardio as much as I can because I feel like whatever you're taking in, you got to get it out somehow. So part of my training and part of when I go to the gym, I have to do cardio of some sort. So it might be the steps, or it might be the or the stairmaster, or the treadmill, or swimming or something. I have to do some sort of cardio. that helps with keeping your weight down. Or in the summertime, I love running. I love jogging. Or even walking. People, some of our listeners might have, bad knees or bad hips. Now, I'm not saying to do a triathlon. I'm just saying if you can't do it, try to keep yourself moving, because you'll be surprised how your body reacts to that. How your body, when it's moving, how it feels great, and all of a sudden you might, like, there are days that I get out of here and I'm exhausted. I want to go right past that gym and go right home, and I'm like, no, I can't. Once I get on the treadmill or the stairs or just doing something cardio, my energy level will go up instantly. So I try and do a lot of my cardio. What I have to do now is, there's such a thing as actually overkill. So I'm somebody that can be at the gym for 3 hours. I can just do my cardio for an hour, do my weight training for an hour, and just swim or something else, because these gyms today are like resorts. I mean, you could swim, go to the
Yeah.
saunas and the steam rooms, and have a good old time. So I have to limit myself, because being in school, I can't be doing 3 hour gyms. But you can get lost. I mean, if you really enjoy being in the gym, you can get lost in the gym. But yeah, no, just I'm a big cardio fan. Just do
Okay.
cardio. I mean, again, if you're not, if you have, you got bad joints, I'm not saying to run a triathlon. Just do something, move
Yeah.
something. Yeah.
Yeah. And going back to my other Italian buddy, Dr. Bimbo Kikio, again, his high intensity training, which is slow uh, exercise with bands, total gym at the
Hmm.
real gym. That's something that people who are listening can consider. I did a video with him, so just search Dr. Tony Hampton, Dr. Ben on YouTube, or you can check the podcast out. And but I do agree with you, man. Cardiac stuff is really awesome, and it kind of helps to keep your mood good. And but the main thing we think about with exercise is our weight loss maintenance tool. That's what
Hmm.
we do to maintain. So when you've lost all of that weight, in order for you to maintain that, and you've already
It's
mentioned the
difficult.
struggles of having a history of obesity, and it's different than a guy like me who never had that struggle. You're going to have to work a little harder. It's not fair, but you got to work a little harder because your metabolic rate will change. And even though if you don't do all those things you're doing, it'll sneak back up on you. So I really encourage anybody listening to take lessons from Anthony
Yeah,
about that.
it's one of those things where you might feel like there are days you might feel you have to just push it. You have to
Yeah,
push through it,
yeah,
because once you stop going to that gym, because again, I mentioned before earlier in the podcast that when COVID hit, there was a setback because
right.
the gyms were closed. And of course, I'm driving home like, oh, I don't have to go to the gym today. I can go home, and there's, of course, whatever snacks are in the house. And then I started gaining some of that weight back.
That's right.
So it could happen if once you start breaking that trend, it's
Yeah,
hard to get back. And then once you lose that weight, it's hard to keep it off,
that's
because you
right.
wanna you think to yourself, you look in the mirror, you go, okay, all right, I could have that extra piece of cake.
That's
No, you
right.
can't.
That's
I can
true.
have that, I can have that extra brownie. No, you can't, because
Yeah,
whatever you're taking in, even though you digest it, you got to remember that gets absorbed, and that's
that's right.
staying. That ain't going anywhere. So you got to get that out. That's what you got to think to yourself. Whatever comes in has to come out.
That's right.
So,
That's right. It's the whole metabolic processes that are occurring in your body, they tend to shift when you put the wrong fuel in your body. So again, the best approach is to figure out the dietary plan you want to have, and then try to stick with it. And then when you cheat, you really are very specific about, like, if we do ice cream ever, we go to, in my area, Oberweis, and we don't bring Oberweis home. Yeah, you drive by Oberweis and you smell the
there's
milk and
shakes.
you want to, yeah, it's like a drug. So that's understood too. So I know you're doing a lot. You're obviously doing your school thing. You're doing this cross, I mean, you're doing a lot right now, and you're working, you're trying to do all of that stuff. So think about your vision for your goals, your vision for your future. Where do you want to be in a few years?
Well, I far as I'm edging towards, and I'm trying to fight it as much as I can towards middle aged, and I don't want to be that middle aged guy that says that with the beer bottle, the beer
Yeah,
belly and the
yeah,
dad bod. I'm not. I don't want that. I'm not ready for that. First of all, my body's not designed for that. I still want to be looking and feeling good in my 50s. My father passed away when I was 17. My father was 52,
Wow.
to the heart, to heart problems. And as I'm edging towards, in 10 years, I will literally be 52. And as I'm edging towards 52, every year I'm thinking to myself, okay, I remember, my dad being overweight, my dad liking his cigarettes, my dad liking his, his car. My dad was a cook. So my dad loved, making breads and pizzas and carbs and blah. And he loved to eat. And my dad was short like me. So my dad, it showed, like his stomach was huge. And my dad in his younger years was a boxer. So it was kind of like, it's weird. So, but I remember when my father died, I remember thinking, this is everything you could possibly do in your middle age. You're not supposed to do. My father did, and I don't want to do that. Um, so I know eventually I say I'm going to retire from the gym. I eventually, when I say I'm going to give it up and just sit at home, and I don't think I ever can. Like I don't want to be one of those guys as I get older and older and older. And it's not because I want to, with longevity. I mean, I feel like I'm a Christian, so I believe that God takes you when He takes you. It's you could be as healthy as a horse. When God says, "Okay, come on, you're going,"
Right.
that's
That's
it.
it. Yeah.
But as far as everything else is concerned, I want to be comfortable. I want to live my life. I want to hopefully meet somebody again. I'm divorced. If anybody's out there, gay, call me. No, but no, I want to live my life. I want to enjoy my life. I want to enjoy, hopefully maybe I might have a kid. I don't know, a child. I don't
Right.
know.
That's right.
I have nieces and nephews, so maybe, they're kids. I don't know. Um, you know, times are tough right now. The world out there is completely
It's
different.
crazy.
And, I just, whatever little enjoyments that I can get out of life, I want. And my future is, my goal is, love, life. What is it? Life, live, love, and happiness or whatever.
All
That's
of
what I
that.
want.
All of it. A real quick fun question before my final question. It's movies. So I recently took my wife to a movie. It was a dinner theater kind of thing, and it was a nice experience. And Matt Damon, that new movie that's out with those guys, and it was very nice. But they had a keto menu, which was really cool. But it made me think about movies. So, what are your? Can you think of two or three of your favorite movies of all time?
Okay, well, I'm glad you said that because I'm going to touch on both things. My Italian heritage and my LGBTQ heritage is what I like to
Oh
call it.
wow!
My first movie, of course, is The Godfather. That was like kindergarten. That's like kindergarten for me.
Yeah.
Kindergarten when I was a kid. I think I watched it at the age of 5. Okay, that's
Okay.
Goodfellas, of course.
Of
Gotta have
course.
my Goodfellas.
That's right.
And speaking on behalf of my LGBTQ community, Birdcage
Oh,
with
gotcha,
Nathan Lane.
gotcha,
Yes, yeah, yeah. Those are my three
got you.
faves.
I love your. I'm definitely a mob guy, so trust me. And Birdcage, I think it's been a minute, but I think I may have to revisit that
Oh,
one.
it's something that you gotta
Check it
really
out.
you
Yeah,
gotta check it
I'm gonna
out because
do
it's
that.
it's it's
Yeah,
hilarious.
I love
And it
it.
actually has a lot of, believe it or not, it has a lot of, it says some images. It takes place in Miami Beach, and it's got
Oh,
some images in there, and you're
interesting.
like, oh yeah, that's why you guys gotta eat. That's why you guys like to eat well, and because the bodies out there are perfect.
That's right. I love that. So I'm gonna let me frame my last question, which I ask all my guests, and then I'll tell you what my three favorite movies are as I'm thinking about it now. And as you know, protecting your nest is an acronym, the nest, and we need a rope. And it's about nutrition, exercise, less stress, more sleep, how we think, avoiding and healing from trauma. And the rope is about having relationships. We've touched on that. Avoiding organisms and pollutants that harm us, and making sure our emotions and our life experiences serve us in a positive way. So I know you're up to, you're doing your diet, exercise, you're doing your intermittent fasting sometimes now. So when you think about your next year, I want you to answer when it comes to that rope and nest where you're going to focus. But before you answer, um, let me think about my three movies. Number one is Gladiator for sure.
Ah,
Love those kind of movies because it's got the little love and a little the armor stuff going. And similarly, The Patriot, I like that movie. And then lastly, Love and Basketball. So even though I wasn't much of a basketball player,
Yes,
I
yes,
love when you can take, it's almost like that Tom Cruise movie, Show Me the Money, that love story. It was like he was an agent, but it was a love story. Whenever you can kind of have something for the guys and the gals, I think that's really
right,
cool. So, love and basketball. I never was a basketball player, so don't ask me to play. I was a tennis player, but just huge movie. And plus, I think because of its African American heritage aspects, that was something that touched me. So
definitely.
now let's get back to you. So anything else beyond what you're doing that you really want to focus on as relates to the nest and the rope? Stress, sleep, any of that stuff.
Well, I have to focus on sleep because I don't get enough of it. I'm one of those people that could fall asleep like at the drop of a hat and then wake up like 2 or 3 o'clock in the morning, and then I'm up, and I'm like, why am I up? Because I literally got to be up and out the door by 7:30, so or 8 o'clock. Nutrition, I it's very important for, and I hope with your listeners, it's very important. Nutrition is you have to eat to live, or
Hmm.
live to eat. Is it eat to
Yeah,
live? Eat to live. Yes,
yeah,
you
yeah.
got to eat to live. Enjoy life when you can, but you have to remember that you have to eat to live. You have to be careful because everything that's going in is not coming out. So you
That's
got to
right.
be careful with
That's
that.
right.
Exercise. People are busy. I mean, Dr. Hampton, you're a busy guy. I mean, all of our doctors, our nurses here are
That's right.
completely busy. Try and find at least 30 minutes of the day to try and at least take a walk, or you don't have to join a gym, a membership or whatever. Try and pick, just take a walk around the building or something. Try and keep yourself motivated. Try and keep yourself going. Sleeping, of course. So sleeping, that, yeah, that's obviously. And then the last one is it stress,
Oh
right?
yeah, stress reduction. Absolutely.
Stress is a big one, and that's one of the number one killers is stress. I'm a very stressful person. I mean, I get stressed. I try not to, but it just happens. Try and take those deep breaths. I also suffer from horrible anxiety disorder. Yeah, generalized anxiety disorder, and it is a terrible. It's a thing,
Yeah,
and it happens at the drop of a hat, and it's one of those
that's
things
right.
where you feel like you are going to die any minute, and it's
That's
it's
right.
not fun. So, and stress is a big trigger. So make sure that you try and do the yoga, try and do breathing, try and do do what you can.
That's right.
Do what you can.
A
And then
lot
the
of good
last one is T. What's the last one?
avoiding how we think, thinking
Think.
positive, and
Yes,
avoiding. Yeah,
positive, positivity, positive. Got to have
yes.
positive. Yes.
Yeah. And you bring a lot of positive energy to the clinic. And I think most people like working with you because of that. So, and it's like it's infectious, it affects
Thank
everybody.
you.
So, that's absolutely a true statement. So, I appreciate you. So, you teased us a little bit about, call me, but in terms of social media, do you have any
Yeah.
social media stuff that people should be aware of where people can find more about you?
Yeah. So I'm definitely able to help. I definitely could help talk to anybody with dietary questions or even training. I've met with some lovely, wonderful coaches that have trained me in the gym, and I could do some training too.
That's
So
right.
you could
Okay.
find me on Facebook. It's Anthony Michael Palermo. That's Palermo. I'm on Facebook. I'm open to anybody, and then you could find me on Instagram. I'm Little Italy 2005. If you can't tell, I'm Italian. Got to use the Little Italy in there. And then you're more than welcome to email me too. I'm Little Italy, hence Italy. Yeah, 2000 wait, 0679 at yahoo.com. You can definitely
Cool.
email me.
Cool.
Yeah, you can find me,
Okay. And I appreciate you offering to help people. We'll definitely have those links in the show notes, so it'll be available for those who really want to interact more. So, and of course,
Yeah.
I appreciate you. We had to squeeze this in, and in fact, I'm going to be going to a meeting as soon as we click done. And but I really appreciate you taking time to be here with me today. I've been wanting to do this. We finally made it happen.
Yes, we did.
And
A
just
couple
thanks
attempts.
again. And I'm going to say a few closing comments and we'll wrap up from there. Okay.
All right. Thank you.
All right. No doubt about it. So, guys, this was a nice episode. We had a chance to meet a member of my healthcare team who has really directly and indirectly supported me many times in clinic, but who today was able to provide some insights beyond just sharing the healing benefits of keto and intermittent fasting. Today, we learned that struggling with obesity may only be scratching the surface, since just being part of the LGBTQ community will lead to struggles that we hadn't thought about. I really hadn't thought about it at all. So, my hope is that by creating awareness, we can, question our biases. I think we all have biases, and we really need to listen to each other, work together to remove those biases so we can create a world that over time such biases become less and less common. So I personally believe that this can happen, will happen, and I only ask that we all do our part to play a role in making this our new reality. So to my guests, I appreciate you, and I appreciate everybody listening for being part of the podcast and or YouTube today. So thank you, my friend Anthony. Got a
Yes, sir.
good name, by the way. I like that name. and
Can't tell what it is.
yeah, it is what it is, right? So, and for all those who are listening or watching, be safe, be well, and continue to protect your nest.